cataract is something that we all know, that we've heard that it is during the old age that people develop, and these are the thoughts that come to our mind. But Dr. Deepa, do you think there is something called as pediatric cataract, and we need to really look at that as an important information that we can share it with the world?
Yeah, sure. Um, Pediatric cataract is well known, even though most people, in the community think that cataract is age related. Babies can be born with cataract. They could develop cataract in their childhood, and it could be post-infection or post-trauma, one of the common causes, and or genetic problems. And yes, they can be treated just like adult cataracts, though the management strategies may be different. Um, but pediatric cataracts do exist. It's not so rare, it's quite common, but early recognition and treatment is the key.
Then, in that case, just thinking about the parents' mindset, I think it will be extremely hard on that to make a decision about what do we do next. So, how do they cope with this, and what do you tell them?
Okay. Um, so once we diagnose a child with pediatric cataract, we have a long consultation with the parents. I explain to them what a cataract is. Um, it's an opacity in the lens. Normally, everybody is born with a clear lens, but any opacity or cloudiness is called cataract. So once they understand that and they understand the impact it has on their visual development, most parents are keen on letting their child have the best management. So very small cataracts that are not likely to impact visual development can be left behind. You don't have to operate. You can just observe them over a period of time and make sure vision is developing.
Right.
The bottom line is every child needs to have normal vision in both eyes, you know. So cataract grows or is large enough that you know it's going to impact vision, that's when you intervene. Um, and some types of cataract, it could be just glasses.
Okay.
So that's an easy fix. But as a child is growing, the glasses prescription will change. So you need to keep optimizing that. So timely follow up and timely change of glasses to make sure that this child's vision is developing normally is the key. And if we exhaust all these options
Right.
and say, okay, there's no other choice but surgery, again, it depends whether it's one eye involvement or both eyes involvement, what's the age of the child, what's the social circumstance of the family, how far do they live, are they remote living, do they have access to easy follow-ups and frequent hospital visits. So there's so many factors that impact that decision. Surgery is probably the easiest part for the surgeon. It's the management, what comes after that.
Right.
Parents have to be committed for lazy vision because that eye has not had good visual development and the child has not seen well with that eye. We need to stimulate vision.
Got it.
So what we do is ask the parents to do patching or eye drops to blur the vision in the good eye so that the lazy eye starts working hard. And this could involve 4 to 6 hours of patching every day.
Every single day.
Yes, and it could be for years that they have to do it, till
What
we
could be the
stop
window?
seeing visual development. Okay, so generally in pediatrics, the first 3 months of life is very critical for visual development, and then till about 7, 8 years of age, where the brain is still plastic and is able to develop vision.
Right.
After about 7, 8 years of age, the wiring in the brain has locked in and you cannot train it anymore. But once they have developed vision before 7, 8 years of age, they usually don't forget it. It's like riding a bike or swimming. Once the neuro connections have happened, it stays forever. And that's why any pediatric cataract, you've got to make sure you assess the degree of visual impairment that the cataract is causing and advise management and make sure the child is being followed up. Because you could tell them wear glasses and come back in 3 months,
Right.
and then they may not turn up for 3 years, saying that, oh, the doctor gave us glasses and our child is fine. Children are never going to verbalize because that age is such you got to bring them, get their vision checked, pick up lazy vision, see what the impact is,
Got it.
and make sure you can offer the right treatment. Um, Often parents come back and forth. When I give them so much information on the first visit, it's a bit too much. So I do give them some website links, including my website, and get them to have a better understanding by reading evidence on management. And they can come back in a week, maybe, or two, when they make up their minds. And some parents may go and have other opinions from other doctors, which is fine.
Which is
But
absolutely
every
fine.
parent wants to give their
Absolutely.
child the best
There's nothing wrong with
outcome.
that. Yeah.
So as long as they have made a well-informed choice, I think most parents would want their children to have the best vision. So it's a large spectrum of problems
Right.
that they have to navigate. So it's a lot for a parent to have a newborn with a diagnosis of a pediatric cataract. But we as doctors, we are committed and we are there to hold their hands and help them make the decision. And I would always try and make it easy as best as I can to help them go through these early years of development.
Right.
And that's the beauty of pediatric specialists. We have the joy of working with parents and children for decades, and we see them grow. So I have patients who have done pediatric cataract surgery maybe 10, 15 years ago, and I still see them. And it gives me joy to see them leading a full life, playing sports, and doing everything like everyone else.
There can't be
That's my privilege.
absolutely. I mean, it shows the overall aspect of how much joy that you would have derived from your own profession with that.
Absolutely.
Awesome, Doc. Thank you so much for your insights on pediatric cataracts. Now, we will have other topics to discuss. Keep watching. Thank you.
Thank you.